My name is Richard Payne, and it's a pleasure to speak to you very briefly tonight. I think Annie said that the center, when the center was founded in 1984, 30 years ago, either she was still in the womb or had just been born. I, in 1984, had just completed about 14 years of college and schooling and medical school and postgraduate training and fellowship training, and was just starting in my first real job as a doctor, as an attending physician in a big cancer center. I didn't have much sense of what bioethics was, except that I had a sense that I should be professional in the way I behaved, respect patients, and generally try to make accurate diagnosis and treatment plans which were of value to patients, and to do that as part of a team. But bioethics and the problems that we face in medicine are surely more, that's some of what we face, but are surely more complicated now. And bioethics as a field has certainly matured a great deal since 1984. I took a casual survey on the internet the other day, and there are at least 59 programs now offering graduate degrees in bioethics, when essentially none existed in 1984. And there are a plethora of programs at the undergraduate level, offering internships and other educational opportunities. However, the Center for Practical Bioethics remains distinct as a freestanding, community-based organization, and it also remains distinct in its focus on the practical of raising and responding to bioethics issues. Irv Hockaday was very eloquent in talking about the mission and vision of the center and its past accomplishments, and I really like that phrase, the hope of science and the complexity of humanity. And I think that really does capture some of the challenges that the center faces. And we still grapple with many of the same questions that the center was facing in 1984, some 30 years ago, and many of those questions remain just as profound. I am told, I'm the holder of the John B. Francis Chair in Bioethics at the center, and I am told that Mr. John Francis was an early supporter. I know he was an early supporter of the center, and would often say something that back in those days that is still highly relevant today. In the advances of medical science, we ought to be asking questions about not what can we do, but what ought we to do. And the center is still having to raise and respond to questions such as those today. So that's the old question, not what can we do, but what ought we to do in the face of some of these amazing scientific advances. But in the increasingly complex and brave new world of healthcare practice, we also face a series of new questions, and ever-expanding new questions that range in the spectrum of health policy, science and technology, and clinical care. Among the many that intrigue me and my colleagues at the center are some of the following. How do we maintain the transparency in our transactions with families and patients, and the highest levels of professionalism in the increasingly complex world of healthcare in the 21st century? And how do we, as healthcare professionals, doctors and nurses in particular, maintain the sense of trustworthiness that are so essential to maintaining the social contract with the public? How do we best steward the precious resources that our society has committed to healthcare? Of all the stakeholders in healthcare, doctors, nurses, other healthcare professionals, institutions, and even general public and patient. We're all stakeholders in this tremendous resource of healthcare in this society. But what goals and responsibilities do we all have in making sure that the most cost-effective and highest quality care is in fact being provided? Those are one series of questions that relate to policy. In the arena of clinical care, how do we fulfill the rhetoric of patient-centered care so that we have true shared decision-making between provider and patient and family, and that we are really attending to the most important interventions and outcomes that maintain health and well-being and the highest possible quality of life? Recently, the National Academy of Science and the Institute of Medicine has been advancing this concept called the Learning Health Center, and we'll actually be discussing this concept tomorrow at the John Berkeley Symposium, in a symposium titled Patients as Teachers, Clinicians as Learners. And we'll be discussing these issues of approaching and how do we provide high quality, efficient care in the 21st century complexity of healthcare, and as a response really to our moral responsibility to steward the precious resources that our society is devoting to healthcare. In another area, I'm a neurologist by training, and the advances in neuroscience and neurobiology have just simply been breathtaking, and particularly in the area of neuroimaging. We now actually have the ability to see in real time the workings of the brain and to probe the mind in both conscious and unconscious individuals. And these are forcing major ethical questions concerning what is the essence of personhood and how do we safeguard and protect our private thoughts. These actually have implications not only in the hospital and the clinic, but in our larger society as well, even into the courtroom and other areas of civic and public life. The ability to manipulate the genetic code and to enhance physical, mental, and cognitive ability of persons is just around the corner. There are, in fact, probably Terminator men in our future. But this raises extraordinary ethical questions about fairness, equality, and even what is the moral status of the genetically altered and biotechnically manipulated person of the future. Now, my point here is that these are profound questions that the center should be in the forefront of raising and responding to. And I'm confident that the center will do that in the same spectacular fashion that it has done in the past. I'm now a member of the family of the center, and we are in fact committed to work on these profound ethical issues in the future, and as we move into the future, and we're committed to do this in collaboration with you in the audience, who are our partners, our colleagues, and our advocates. I have witnessed for a good part of the past 30 years the ways in which the center has drawn people together to overcome self-interest, to find common ground, and to resolve conflicts and achieve better results for all parties. So we need to continue to do that work, and now it is more important than ever to do so. So I actually now have the best line, I think, of the night, because it is that I have concluded, and we can now continue with dinner. But I want to thank you all for celebrating with us, and please enjoy your dinner. Bon appetit.